I'm Megan, the public health pharmacist, and I think that everybody should know how their medicines work, at least on a basic fundamental level. Now, usually I talk about how meds work in terms of a drug class, but today we're doing things a little differently. I'm going to be talking about a specific drug because people can't seem to keep this medicine's name out of their mouth. You know what I'm saying? Mifepristone is one of the medications that is used for medication abortion in the US. And for a drug that has been approved for over 20 years, used effectively and safely by millions of people, trying to rescind the approval of mifepristone is just like batshit crazy. Beyond that, though, I think everyone should understand how this medicine works because abortion is healthcare. So the hormone progesterone is very important during pregnancy. Progesterone is responsible for three things: keeping the cervix closed. It's also responsible for making sure that the muscular layer of the uterus is not contracting. Lastly, progesterone prohibits prostaglandins from being secreted. Prostaglandins are messengers that would encourage the uterine wall to contract, which is not what you want during pregnancy. In order to do those three things we just talked about, progesterone has to first bind the progesterone receptor. Mifepristone says, nah, actually, I'm gonna bind the progesterone receptor, and that keeps progesterone from being able to bind it, which keeps progesterone from doing those three things that we just talked about. So as a result, mifepristone leads to dilation of the cervix. It leads to the secretion of prostaglandins that encourage that uterine wall to contract, and it leads to that uterine wall contracting. That's how mifepristone is used as a part of a medication abortion regimen. This also explains its use in miscarriage management. Now, why is the uterine lining important during a pregnancy? Because this is where an egg attaches. And as progesterone levels decrease, this lining falls away and it takes the egg, embryo, fetus along with it. Share this with a friend because your medicine shouldn't be a mystery, nor should they be unfairly weaponized, criticized, demonized, or had their access limited because of political beliefs.